Why does my child with asthma wheeze? Imagine trying to breathe through a tiny straw. That's what it can feel like for a child with asthma when they wheeze. Wheezing happens because the airways in their lungs become narrower, making it harder for air to flow freely. This narrowing is caused by a mix of factors. First, the lining of the airways becomes inflamed or swollen, which reduces the space available for air to pass through. Second, the muscles around the airways tighten or go into spasm, further constricting the passage. Third, the body produces more mucus than usual, which can clog the airways and block airflow. All these changes cause a whistling or squeaking sound when the child breathes out, which is what we call wheezing. In children with asthma, the airways are often inflamed even when they seem fine. Certain things can make this inflammation worse and trigger wheezing episodes. Common triggers include respiratory infections like colds caused by viruses such as respiratory syncytial virus or rhinovirus. Allergies to things like pollen, dust, or pet dander can also inflame the airways. Exposure to irritants like tobacco smoke, cold air, or strong smells can cause the muscles around the airways to tighten suddenly. Physical activity or exercise can sometimes trigger wheezing too, especially if the airways are already inflamed. Stress or strong emotions may also play a role in worsening symptoms. Wheezing is a sign that the airways are narrowed and that the child might be experiencing an asthma flare-up or attack. During these times, they might cough more than usual, feel tightness in their chest, have trouble catching their breath, or find it hard to breathe. In very young children, wheezing often happens during viral infections, which can sometimes lead to or worsen asthma over time. It's important to remember that wheezing can also be caused by other health issues, but in children diagnosed with asthma, it usually points to airway inflammation and muscle tightening. Managing wheezing involves avoiding known triggers whenever possible. Following the asthma action plan provided by the child's healthcare provider is essential. Medications like inhaled corticosteroids help reduce inflammation in the airways, while bronchodilators relax the muscles around the airways to make breathing easier. Using these medications as prescribed can prevent severe attacks and help keep the lungs healthy as your child grows. If you notice your child's wheezing worsening or not improving with treatment, it's important to seek medical advice promptly. Regular checkups and proper management can help your child breathe more comfortably and enjoy daily activities without fear of sudden wheezing episodes. In summary, your child with asthma wheezes because their airways become inflamed, swollen, and tight in response to various triggers. This makes breathing noisy and sometimes difficult. Wheezing is a key symptom of asthma and signals that careful management and medical treatment are needed to keep your child's lungs healthy and their symptoms under control. Always consult healthcare professionals for personalized advice and treatment options tailored to your child's needs.